This is the pharmaphorum podcast. My name's Dominic Tyre, and I'm pharmaphorum's creative and editorial director. In episode 19, we're looking at the use of Amazon's Alexa in healthcare and a new Alexa skill from Eisai for a rare and severe form of childhood epilepsy. Joining me on the podcast is the company's Chief Strategy Officer for its US Neurology Business Group, Alexander Scott. We discuss the emergence of voice technology, its healthcare applications, and how it can help with unmet patient needs in epilepsy. Eisai's efforts in this area include its Ella the Jellyfish Alexa skill, which aims to go beyond providing healthcare information to give support and solace to patients, families and carers. You can find more details of this episode, including a download link for the podcast and information about other instalments in the series at pharmaphorum.com/podcast. The pharmaphorum podcast is also available on iTunes, Spotify, Acast and Stitcher, where you can find and subscribe to it by searching for pharmaphorum. Alex, welcome to the pharmaphorum podcast. I'm really excited for our chat around use of voice technology within epilepsy. But before we get on to that, I wonder if you could set the scene, say a few words about yourself and perhaps Eisai's use of digital technology to date.
Great, thank you, Dominic. So I'm Alex Scott. I'm the Chief Strategy Officer for Eisai Inc., which is the U.S. subsidiary of Eisai Company Limited, based in Tokyo. I'm also the Chief Strategy Officer for our Global Neurology Business Group. And I've been with the company for 23 years. It's been a really exciting and engaging career, especially as we now begin to look into the future and bringing forward new technologies and new ways of engaging with patients and potentially delivering to them improved services and products using technology. It's a really exciting time for us.
It certainly sounds like that's the case. So I'd like to jump straight in to look at the new Alexa skill that's developed and that's now gone live. So that introduces us to the character Ella the Jellyfish, doesn't it? Can you tell us a bit about that?
Sure. One of the hallmarks of Eisai is, as a company and globally, we ask every employee to spend at least 1% of their business time engaging directly with patients. And that's a really impactful way for all of us in the Eisai community to get a real understanding of patient reality and patient challenges, especially those kinds of patients that are dealing and their family members that are dealing with really serious conditions like Lennox-Gastaut syndrome, a very severe form of childhood onset epilepsy. And it's through those particular interactions over the years that we came up with the concept of trying to build something that would be very appropriate for these children and their families who have, the children at least, will have multiple seizures a day, different types of seizures, and have cognitive and behavioral challenges associated with that. So we realized that there weren't any technologies that were easy for them to interact with and utilize, et cetera, in terms of being able to play games, being able to listen to stories, et cetera. So we sort of saw this new area of voice skills on the Amazon platform as a wonderful potential way of allowing people who may have difficulties accessing technology, being able to interact with technology more seamlessly. And that's what sort of was the origin of building this particular skill.
Mm-hmm. We're seeing more and more Alexa health skills then being released out into the wild at the moment. But certainly most of the ones that I've seen to date seem to take more of almost a transactional approach to the technology. You ask it to do something, it provides you with information, whether that's scheduling an appointment or providing sort of health information, which we certainly see here in the UK with some of the work that's being done via the platform. But in terms of your company's work, you're trying to take, well, I wonder how you'd describe it. It's more of not quite an entertainment approach, but it's certainly more engaging for patients than other examples that I've provided.
Sure. We think of this as entertainment with a mission, and that mission is to, also be helpful to patients and their families. These children generally require 24/7 care, provides a lot of stress on the families. So being able to allow the child to do something with Ella the jellyfish while a parent is able to, cook dinner or, is a really nice respite for people who are having to provide that kind of care constantly. It also, some of the games, et cetera, are, set up to be able to allow the whole family to kind of interact with one another so that the child with Lennox-Gastaut syndrome isn't, is sort of able to be at the center of the game rather than sort of participating from the periphery. We think that's really valuable. I mean, we're really committed to this particular community. We've served them through providing medicines for the past decade or so, and this is one way in which we can give back to that community and give them something that we believe will, lead to healthier and happier lives.
And as you were working on the development of the skill, which of course is it's just gone live now, what sort of feedback have you had from maybe from patients' families or carers?
So far, the feedback is excellent, and we utilize patients and family members as we built the skill. If you go to ellathejellyfish.com, we have a couple of videos of some of the impact of the skill on children, and it's those are wonderful ways to see how the skill can actually, really help calm a hyperactive child, and it's really heartwarming to see that.
And in terms of the characters involved in the skill and this particular approach, what's next, do you think, for it? Are there other platform opportunities, do you think, or is it more going to be held within just the voice-activated realm?
Currently, we want to sort of put it out in the voice-activated realm. We see that as a technology that these people can interact with easily, rather than having to operate a tablet or a computer, et cetera. We think we'll be looking to develop the skill further and adding new elements to it. Right now we have a short meditation, a longer meditation, but potentially, we'd come up with ideas like, a meditation specifically to help someone go to sleep, things like that, other kinds of stories, additional content, et cetera. I think for Eisai, this is also an exploration of utilizing this kind of new technology as a way of engaging with patients and a way of engaging with family members, et cetera. A good experience case for us as well.
Wonder what your thoughts are then on just in general the use of voice technology within epilepsy. Where would you see the benefits, and I suppose what attracted you to its use in the first place?
Voice technology is really easy and natural for people to interact with, which is sort of the first step. And especially, again, people with epilepsy who may have physical challenges with interacting with technology. This allows them to sort of work with the technology where they're at, rather than having to try and adapt to the technology. As an overall platform and ways to engage, definitely a way that we can provide additional information to people over time in terms of disease state education. There may even be approaches within the epilepsy community or in other communities in which we can do things like bring forward coaching, cognitive behavioral therapy. I think the future of this platform is really kind of wide in terms of the sorts of things that can be delivered to people, and both from a fun, engaging kind of way to something that may be more therapeutic or more supportive.
And it certainly does feel like we're probably only really scratching the surface, as it were, with the potential applications for voice technology in general, I guess, at the moment, as it becomes more embedded within the mainstream, but particularly in healthcare, as companies, healthcare bodies look to see what the options are, how they can be effectively used, whilst also being mindful of the regulatory concerns in which they have to operate.
Certainly. And as we all know, in every country, there are very different regulatory requirements and personal health information requirements, et cetera. And we're very cognizant of sort of moving along with the regulators to ensure that, everything is done in an appropriate way as we understand and leverage this new platform.
With your chief strategy officer's hat on, if you like, I wonder where you see the role for digital technologies in general when it comes to meeting patient needs in epilepsy.
I think it's pretty significant. significant. There's in terms of what technology can do for people. It can help deliver healthcare in a more convenient way to people. And certainly we're seeing that with telemedicine. But potentially, there might be ways of doing that through voice-activated platforms such as Alexa for Amazon or other such technologies. So that's one area in which I think the future is quite interesting. I sort of see these as audio web pages. They're ways of being able to, as a platform, as a technology advances, of being able to have more and more complex interactions across the platform in terms of providing information, in terms of providing patient support, and ultimately potentially types of digital therapies to patients as well.
Where do you think digital technology can best meet unmet needs in epilepsy? I wonder, first of all, perhaps where do you see the greatest unmet patient need in epilepsy, and then where do you think there might be a role for digital within that?
Sure. Within epilepsy, there's still a lot of patients who have uncontrolled seizures. It's a kind of disease that's highly isolating, and I think one of the first ways that even patients who are on medication may reduce their number of seizures by half, but they're still suffering from seizures. There's a stigma associated with it. And so potentially these voice technologies can do things like create communities of people so that the isolation is broken down and that people can feel more connected with those who are facing the same challenges that they have. And, until we're able to come up with a world in which people don't suffer from seizures, I think that's a really important step that these kinds of technologies can address. And that's what we're looking to do with Ella the jellyfish for that particular community in Lennox-Gastaut syndrome. Sort of remove the sense of isolation that these families and these children feel.
Alex, thank you very much for introducing us to Ella the jellyfish, but also running through some of the very interesting ways in which voice technology and digital technology more generally might be applied within epilepsy. So thank you for joining me for the pharmaphorum podcast.
Dominic, thank you. I really appreciate the opportunity and look forward to speaking to you again as we bring forward, hopefully, new approaches on this platform as well.
And that concludes episode 19 of the pharmaphorum podcast and my discussion with Eisai's Alexander Scott about voice technology in healthcare and epilepsy. You can find more details of this episode, including a download link for the podcast and information about other installments in the series at pharmaphorum.com/podcast. The pharmaphorum podcast is also available on iTunes, Spotify, Acast and Stitcher, where you can find and subscribe to it by searching for pharmaphorum. And don't forget to visit our website to sign up for daily or weekly email, pharmaceutical news and analysis bulletins, and follow us on Twitter, where we are at pharmaphorum.